Hey, everyone. It's Dr. Tamara Beckford with Your Caring Dogs. That's where we help our busy professional women put their health and wellness first for at least 2 hours a month. That's right. Why? Because there are 730 hours in the month. You can dedicate two to yourselves, right? We have our lovely podcast, our Your Caring Docs, Docs and Cares, where we have doctors from all over the world. They stop by here, they drop their gems, aka all this great info. And the best part is that they leave their information so you can know where to find them if you'd like to be a patient or a client. Today, I got a doc. Boom, boom. If you haven't seen the name on the screen. It's a 2.0. Yep, it's a double. It's a square. All y'all mathematicians out there, that's right. So I'm going to bring in this doc with our same name but different pronunciation in our very, very, very Your Caring Docs fashion, right? So this doc is a graduate of the Medical College of Georgia, right? And she did her training in orthopedic surgery. That's right. We have a lady pod here. That's right. She did her training in orthopedic surgery at the Ochsner Clinic in New Orleans. So all my New Orleans folks, boom, boom. Hey, all my GA people, stand up. Yes, she's one of yours. She is the founder and CEO of Vigio Orthopedics, where she delivers compassionate and high-quality, cost-effective orthopedic surgical care to hospitals throughout the United States. She's also an executive steering committee member of the Movement is Life Caucus, where she is a national presenter on confronting musculoskeletal and health disparities and implements community-based solution. All my people, all my lady pods out there, let's give it up for the one and only Dr. Tamara Huff. Yay. Oh, my lady pod, stand up. Yes. How are you, Doc?
I'm great. I'm so happy to be here. I really am.
Hey, me too. Okay. So, I done introduced you to all of our members.
I feel so fancy.
Listening. Now we're going to dig in and try to find out more about you. So, Dr. Huff, tell us, what made you go into medicine?
So I'm one of those few people that knew kind of what they wanted to do when I was a little kid. So I actually used to fix houses with my mom. We would lay tile, patch walls. She actually built the cabinets in my grandmother's house. So I've always been working with my hands. I was working in the yard, everywhere. And as most surgeons, well, there's a lot of orthopedic surgeons that happens is you break something, you hurt something. So I hurt my knee and I went to an orthopedic surgeon, and it just so happened it was a family friend, and he was just getting out of training, super nice guy. And he was explaining the field to me. I was like, wow, this is kind of neat. And somehow I weaseled my way into an operating room at 14 years old. And I had a chance to watch a surgery. And I'll never forget, I walked in and there was this big Craftsman's tool chest. I don't know if you've ever seen them, the tall ones that have the drawers in them.
Yeah, tons of drawers.
Yeah. So there was a red one. And it was
that's exactly what I'm picturing.
Yes, it's like a red Craftsman's tool chest with the rows in it that you would see in a garage somewhere. And it was almost as tall as me. It's huge. And on the top, it had the doctor's name and said his toy chest in there. I was like, what is this? I get into surgery, I start looking, and there's chisels, there's something we use called a bone cement gun. It's very similar to a caulking gun that you use in woodwork and stuff. I was like, sign me up. You mean I can fix people? Like what I do with my hands, I can do this. And I was sold. I was sold from 13, 14 years old. And I did a lot of things that people might not have thought were along the path, but I was sold. I became a physical therapy aide. I kind of volunteered all I could.
Let me learn about all the movements, because once I start, it is on.
Yeah, so I was sold. So yeah, I literally couldn't imagine not doing it, but yeah.
Wow. So, from the jump, you were just good with your hands at fixing things. And then you got introduced to an orthopedic surgeon, which is why we said so important for the exposure, right? Because other than that, you're so good at your hands, you're doing all of these things, but you wouldn't even have known that I can actually do exactly what I'm doing to fix these houses and use it, that same skills in another way and fix people.
Yes.
And then you saw the tool, and then you saw the tools that you were already using.
Like, sign me up. This is it.
Absolutely. I love it. I love it. Alrighty. So went into med school, you already knew what was going on. You already knew. And you're already like on the path. Now, for those of you who are listening or who are watching, orthopedic surgery is a very challenging specialty to get into, number one. And there are not that many female orthopedic surgeons out there. Yeah. Number two, and there aren't that many Black female orthopedic surgeons out there. Number three. So when we meet Dr. Tamara Huff, we're meeting one of our unicorns out here. Like we said, one of our unicorns. So, you've really gone and you battled and you're in residency at Ochsner. Now, the thing that I love about when you're in residency, it's not like, for all of y'all out there, it's not like Dr. Huff just went into residency. She just had her head down and just grinding. She's like on this committee, she's on that committee, she's running this here, she's doing community liaison. How did you do all of this?
I think that was kind of how, I don't know, it kept me interested. And I think we definitely were focused, and it was definitely a lot of operating and a lot of working, but I think
get out without that.
Yeah.
How did you do all these other things?
Well, I had a wonderful program director, and the chairman that was there who interviewed me and hired me saw that I was really excited about those kind of things early on. So they were super supportive, because I think they had really never had anybody quite like me before. So when I said, hey, can I sit as a resident liaison to the Academy of Orthopedic Surgery? They're like, why not? We've never had one of those before. Can I do this? I was like, oh, we never had somebody do that before. And it was just great. I had a chance to present internationally. It was like anything I applied for and I got it, they were like, go.
Supportive.
Yeah, they were super supportive, stuff like that.
Wonderful, wonderful, wonderful. So now, we finished residency, we're out there working. And then now, we have this wonderful, wonderful caucus, that's out there that's helping with movement. Now, one of the goals of the movement is Life Caucus is to ensure that, people are moving, and especially we keep movement going, even if there is an impingement to the movement, right? So that movement helps with life in a sense, right? It's a cycle that's going on. If you stop moving, then you can have a lot of health issues, heart issues, obesity that can lead to a lot of health issues. And then if the health issues are there, what's going to happen? You're going to stop moving because you're like, well, I got my health issues, so I can't move. And so, but we know that the opposite occurs. If you keep in movement, you can try to reduce all of this. And especially enlightening people I guess we wanted to say people who aren't completely aware, right? And with health disparities, become aware that this is why it's important to keep moving. Now, we all know that things hurt, because right now I'm dealing with a hip pain and a shoulder pain. And the last thing that people want to do when they hurt is to move. So let's talk about how this caucus is out there helping people, and how you got introduced to this wonderful caucus in the first place.
Well, Moving is Life Caucus is near and dear to my heart. I've been involved in it for, over 7 years, pretty much coming straight out of training. When I came out of training, I started practicing in a rural area of Southeast Georgia. And I'm looking around, and so many of my patients had so many other issues. And I think many times we don't realize when our bodies can't move, when our joints are hurting, or our hips are hurting, our knees are hurting, we can't do what we want to do. And that really does affect you mentally. it's not just a physical pain. People get depressed.
Yes.
You stop moving even more, then you gain weight and you go, it becomes that vicious cycle that you described. You really, just one thing leads to another. You have to start getting heart disease. You start having depression. It just feeds on itself. And I saw that in my patients. And I actually first got introduced into the program through some of our community outreach, where we had a grant that down in Waycross, Georgia, where I was, where we focused on Black women over the age of 45 that had knee pain, but we wanted to address all those other things around there. Like how, if we gave you the education where you could ask any question you wanted, if we could actually have what we call, educational activities, then also physical activities, and then motivational interviewing, which to me is the key piece, where you kind of find out why you're doing what you're doing and what you could be doing differently. And we actually had group leaders that helped those young ladies figure things out. So in taking people through that, I really saw that nobody's losing a ton of weight, but their clothes fit better. They feel better. They have more energy. They have more self-worth, self-value. Can we do that on a larger scale? So Movement is Life Caucus is a group of diverse individuals. There's orthopedic surgeons, there's primary care doctors, physical therapists, psychiatrists, religious people from the religious community, people from pharmaceutical companies and health insurance agencies, people that are also policymakers. And we're all coming together to see how we can improve movement and improve access to care for women, especially African-American women and Hispanic women and women in rural areas. Right. So how do these women who we're carrying the burden of our communities, of our families on our backs, how can we continue to keep them moving and keep them with the access to care that they need? So that's our central mission. And I've just kind of jumped all over that. So I believe in all of those pillars.
Yeah, absolutely. And you know what I love about it is that it's recognizing, and it's not to take away from the male in the family unit, but us as females, we're just gonna keep it real right now. We carry a lot of the burden in the family, and we also neglect ourselves a lot in order to carry that burden, right? So we have our kids that needs things done. A mom is going to make sure that the kid gets things done, right? My kid needs this. We're going to work hard to ensure that they have it at sometimes the expense of our own health. And so it's important in understanding that, right? And making, I love the fact that this caucus is multidisciplinary, because if I go out as a doctor and I'm telling you, hey, this is what you need to do, and I can't get into your mind to understand why it is that you're making those decisions, the likelihood of you being able to change is going to be low, right? Because I don't understand, well, the reason why I didn't make this decision is because this is what's going on in my life right now, from the psychological standpoint or from the financial standpoint, or, so I can bat off my head all I want, but if I don't get into the root cause, then we can't expect change. And that's why I love, with this caucus, it really helps in getting to the root cause. Because like you're saying, the patient might not, lose weight on the scale per se, but there is a change in how they're feeling and how they are now attacking their life, right? With intent and in purpose. And then they feel better. And so the movement is continuing. And then with that, when you're able to do, to really invoke that into the community, right? What if you tell one person, then that person can now tell another person, and then it can go on and on, right? Because they live in that community. They know what goes on in that community. We're visitors, which, we've been privileged to enter into the community. So I think this is a wonderful. So I'm talking about it like I'm the one.
I love it. And what you hit on such an important part, and one of the core tenets of Operation Change, which is one of our kind of signature projects that we do. Operation Change is about the community. It's we bring in people from their community that live there. We want you to connect. Like, it's so cool when you're at one of the events and people that literally live less than a couple of blocks from each other, never knew each other, and like have new besties. So you see them the first time around and they're kind of looking around like, what you got me signed up for? And then
Right?
12 to 18 weeks later, we can't send them home. Everybody's so excited.
Absolutely.
And just like you talked about is we're not excluding our guys, because I get a lot of my guys,
and that's where like we're not
always upset, but like, no, when the woman is truly the backbone of the family, and when you educate her about movement, one of my favorite patients and participants in the group, she started just walking and like doing steps around the house. Then she started walking around the track. She got her husband that was on dialysis. He started walking around the track. She got her daughter. By the time we were like a month or so into it, she had the whole family walking around the YMCA track at like 6 o'clock in the morning. That is crazy time, but that's a whole change. That she was inspiration to her family. She was inspiration to her community, her church family. It was, so that's kind of how you throw that pebble that has the ripples that go across our entire community. So
absolutely,
love it.
Absolutely. And like you said, that pebble that gets the ripple effect, which is kind of the same thing now that happened with the Movement is Life caucus, right? So you had a ripple effect from that. You started noticing that, and then you decided to use what you are gaining from that to even make a bigger change outside of that. And there you go, and you birth Vigio Orthopedics. So tell us about Vigio Orthopedics.
So Vigio Orthopedics is my baby. It's my business. So in 2019, I looked around and I realized that I wasn't necessarily practicing medicine the way I wanted to be. I thought there was a different way to make sure that you could still have that compassionate care, that high quality care that's still cost effective, that leaves you fulfilled at the end. So at that point, I looked around, like, okay, how do I make this happen? And that's where Vigio was birthed. So Vigio is basically a 3-pronged company where the first portion is patient care. It's patient-centered care, and we provide services for areas of the country that might have a hard time getting an orthopedic surgeon, rural areas that are even urban areas that don't necessarily have the greatest resources around for that community. So we're providing access to care, and we're doing it with the gold standard. So you're getting evidence-based care that isn't just, okay, I went to school 20 years ago. This is what our Academy of Orthopedic Surgeons is saying. We're on top of those things. So, and we do integrated care. So we talk about the importance of physical therapy. We talk about, and we constantly implement nutrition. There's so many things that go into having healthy bones and joints. I want to give that kind of care to my patients. So that's the main arm of Vigio Orthopedics. Our secondary arm is that consulting. So the ability to talk to different orthopedic practices, especially to their administrators, and say, okay, this is how you connect with patients. This is how you keep them engaged. This is how you can build a practice that's more welcoming and friendly to patients that are diverse, whether they're in rural areas or urban areas, but we can all connect, and I think there's something very special to be seen about, and there's some very, very good studies that show that African Americans in particular, we get better care from other African American physicians. We connect better. So I can't duplicate myself across the country, but I can help others learn how to connect with us better.
Absolutely.
And then that third arm is our outreach to corporate entities and to community entities. So building on some of the models and things that we did through Movement is Life, and that I learned working in rural America, all over the Southeast and Midwest, I try to share that education with corporations that want to bring that knowledge to their communities. I still go, and we still work with actual churches and social groups that want to do things, sororities and areas that are trying to fill out, how do I get our group moving? How do I increase access to care? So that is a part of Vigio that may be a little bit more obvious to people. If you Google me, you'll see the LadyBoneDoc brand. Yes. That's that portion of Vigio where we're out there and we're trying to educate people about how to get that great care that you need, how to prevent having to have surgery if you don't need it, just how to thrive, how to be and have a better life.
Absolutely. That is so wonderful. I love how you look around, and that's how a lot of great businesses are formed, right? You look around and you're like, okay, well, I see this need that's out there, and I've been able to do this. So why not? Like you said, I can't, even though we both have the same name, I know you're like, well, you just replicated it right now because we both have the same, but like Dr. Huff said, she can't really replicate Dr. Huff and spread her all over physically, but she can help others and other orthopedic companies or other orthopedic groups throughout the country be able to deliver excellent care, especially those who are delivering care to minorities, and so they can connect with them. And when you connect with the patient, we all know that the patient ends up with a better outcome. And that's what us as physicians, we want in the first place. When we put in all that work, we love to see a great outcome. And as I often say to like our patients or the audience who are listening, who are like non-medical, doctors, we don't like bad outcomes. It really affects us. It hurts. It hurts. Like we go home and cry. We might not cry in front of your face, but we go home and cry, right? Yeah. So anything that we can do to really have a great outcome is wonderful. And Vigio, this is what Dr. Huff is out here doing, really helping to connect and help these orthopedic groups really get the best outcome in all of their surgeries, in all of their treatment for especially patients who might not look like all their patient population, right? How do I connect with that set? This is how you do it, through Vigio Orthopedics. All righty, so we done dug into Dr. Huff about her, why she went into orthopedics. We figured out that she's great with power tools. And, she's really, really great with helping the community with movements. And she's developed this wonderful company, Vigio Orthopedics. I mean, that's a lot of stuff, doctor. We're doing a lot. Now we want to know, what are you doing for self-care?
So I am a believer in self-care. I might not have always been, but I am definitely a believer now. So for me, every month I do a massage. I have this amazing massage therapist. She is phenomenal.
I had to send her my way.
Wildwood Day Spa in Columbus, Georgia. She is absolutely terrific. Angela, I've sent way too many people to her. I'm like, I'm never going to get an appointment again. I'm telling you, she is phenomenal. And basically, I keep a maintenance appointment every month. It started off just 60 minutes. I'm up to 90 minutes now, but that's what is what I need to have balance. I carry my stress in my shoulders, my back. I am extremely tight. I'm working on stretching. That's why therapy and physical therapy is important. But
yes.
But that is, during the pandemic, I did not do that. And I could tell the difference. It was a huge difference. The other part of it for me is movement really is a self-care thing for me. So typically pre-pandemic, I was definitely more of a gym rat. Now I'm not as much, but if I am not outside moving, whether it's in my yard or it's taking a walk, cycling, if it's not something where I'm out moving, I will go stir crazy, and it affects my mental health. So I think those things, so definitely the massage. Yeah, highly recommend it to everybody. Even if you just start off with a 30-minute and work your way up, highly recommend having that time for yourself, and then some form of movement. It just, it changes.
Is, like you said, movement is life. Movement is life. And I love how and that's one of the things too, like, here with Your Care and Docs, we said, women, put your health and wellness first for at least 2 hours a month. And yeah, we do have a Your Care Society, which I'll talk about later. But that's one of the things I myself have come to realize, because I think that as we go through life, we just kind of like, well, I have this to do, I have that to do. And then self-care gets placed on the back burner. But once you start even just giving it a little bit of a chance, give me a chance. That's what self-care is like. Please just give me a chance. And you start to implement it, you start to feel so much better. And then you're able to do all that you really wanted to do, which is what you had, why you place self-care on the back burner. You're able to do that with better energy, with going towards it with a better attitude, and really getting more done in even less time. So, self-care is very, very, very important. So I'm glad that we saw the difference too, because pandemic, boy, Corona really tried to steal our self-care, but we're going to take it back. We're going to reclaim our time.
Yes, I took it back with a vengeance.
I love it. Yes.
I highly recommend, and just always block that time out on your schedule. It is more important than any other meeting you have. And people know, do not call me during this. You will know.
Yeah, absolutely. Absolutely. No. And you thank us. You'll thank us. You see our names is twice. You'll thank us. It can't be wrong if we're saying it twice and you're looking into seeing the same name twice, right? Alrighty. So our next thing now is, so Dr. Huff, if you were the doctor, what would you be?
I would be a history professor that in their free time dug in their yard a lot.
I love it. So you do archaeology and history?
So I actually was a history major back in the day, and I have a fierce interest in the history of medicine and how medicine is used as a political tool. So I love history and politics, and I'm a pretty avid reader. I would be a professor. And when I was not professing or lecturing and involved with that.
First history professor, I love.
Yeah, if I wasn't a history professor, then I would be working in my yard and I would be planting my flowers and doing my hedges. And yeah, I would be digging around in my yard.
My second gardener and first history. So my other gardener, he's there in Georgia too, Dr. Edie Allen. He also loves gardening. Yeah, pain management specialist there in Georgia. I love it. But our first history professor, this is wonderful. Man, so talented. I love it. So, Dr. Huff, out here, everyone's listening. They're like, wow, this is such a great doc. She is really out there helping the other orthopedic groups. She's providing her services to hospitals who might not be able to afford or even have a orthopedic doc on staff. And, we all know it's so important because a lot of people, I'm an ER doc. Matter of fact, I spoke to ortho twice last night. So I did. I had my little old lady, she was going to book club and she stepped down wrong and she, ended up breaking her femur. Yeah, poor little old lady. But what did I need? I needed the orthopedic. And this happens not just, randomly, it happens to people. And so you being able to help hospitals who are in maybe like in rural areas where they're unable to have an orthopedic surgeon, I mean, that's just wonderful. So I know people are listening like, oh, wow, she does that. And she's also she has this 3 arms to her practice. She's helping hospitals who don't have orthopedic docs. She's also helping practices to communicate and to be able to better treat their patients, especially the minority patients. And she's out here helping communities to build programs so that they can have movement. All right, I need this doc on my side. I need to know, how can I find her? So let those people know where they can find you.
Okay, so if you're interested in orthopedic care, especially if you're in the Baton Rouge, Louisiana area, you can find me at www.vigeo-orthopedics. That's VIGEOORTO.com, vigeo-ortho.com. And I'm at Ochsner Clinic in Baton Rouge. That's where I practice at currently. If you're somebody that's interested in getting more information on how you can expand your care, so if you're an orthopedic surgeon or someone in PMR or anything that would like to know, how can I really connect with rural communities or communities of color, vigeo-ortho.com is another great resource. If you are interested in building community programs and partnering with organizations to help build these programs, again, vigeo-ortho.com. We have some great opportunities there and we can set something up. And if you're just interested in having some more information about your joint pain and about how to get moving and keep moving, then you can visit LadyBoneDoc.com.
Mhm.
And that's more of our patient-facing arm. So you can kind of see what we're doing and get some tips on nutrition and all that great stuff.
Yes, wonderful, wonderful. Yeah, nutrition, movement, all of that to kind of have a what does Dr. Huff do? Let me see what she's doing outside of
And
those the corporate
stretches for those
portion.
hips. Stretches
Girl,
for those hips.
yeah. She's talking to me. Yes, yes, the LadyBoneDoc. That's where we can find you. Are you also on so LadyBoneDoc, we can find you on what social media handles is our LadyBoneDoc?
Perfect. And thank you for reminding me. So I'm on Instagram and Twitter at LadyBoneDoc. Again, Instagram, Twitter at LadyBoneDoc. And then for Facebook and LinkedIn, it's just Tamara Huff, MD. And I pop up.
Tamara Huff, MD. That's right. So thank you, Dr. Huff, for stopping by and really laying out all of these great options out there for hospitals, for businesses, for orthopedic practices, and also for communities. Hey, Vigeo Ortho, is it .com?
Mm-hmm.
Yeah, Vigeo, VIGEOORTHO.com. That's right. So thank you so much. This wonderful podcast will be available on our Your Caring Docs. It's our Your Caring Docs on our Facebook. Yes, because Facebook is now doing podcasts. So boop, there you go. You're going to be on Facebook. Also on our YouTube channel, which is Your Caring Docs. So it's YouTube/URCARINGDOCS. Also, we'll have it on our Your Caring Docs website. We're still trying to get that part together. We have so many wonderful interviews with so many wonderful docs, but we will drop this interview on everywhere where you do listen to your podcast, right? So if you are on Apple, Spotify, Anchor, Google, you will hear this wonderful podcast there. Like I said, if you want to get in contact with Dr. Tamara Huff, you had 2 ways, right, to find out. So if you are a business, you have VigioOrtho.com. If you'd like to find out what's going on, what is Dr. Huff talking about with these patient care? Let me see what she does on a day-to-day basis. What does she do? Then you go and see our at LadyBoneDoc, right? That is her on Twitter and Instagram, right? But if you are on Facebook, you just put in Tamara Huff. See, I'm calling her. My name is Tamara. Hers is Tamara. Tamara Huff, MD, and you will find her there. So all our people, we thank you. This is Your Caring Doctor. We're helping our busy professional women put their health and wellness first for at least 2 hours a month. We have our wonderful Your Caring Society. That's right. Our Your Caring Society that's out there helping women. We have our cohorts. We have our first set that's coming up in January of this year. So we have wonderful speakers. We have speakers on same thing with movement, right? With weight loss, obesity, weight loss and weight regain, getting your mind on track. So it's not that we know that it takes more than just telling you to do this. We really want to get into getting your mind back on track. And that's our wonderful Dr. Alicia Shelley from the GA, top 40 under 40 and New York City Marathon runner. Yes, just completed that 2 days ago. And we also have the wonderful, Dr. Catherine Toomer, who is our TEDx speaker. Yes, she's going to help us also get and ignite all of the passion and kind of get our mind right for 2022. We're going to do it big, ladies, in 2022. We have our wonderful Dr. Rachel Rubin, who is a urologist and one of the first females, or a handful of females, I should say, who is an expert in male and female sexual medicine. And we have our MedFit DO. Yeah, we got it all. We're going to do it right. 2022 is our year. We're gonna be in it, winning it in 2022. So if you'd love to be part of the Your Caring Society, go to yourcaringdocs.com. That's URCARINGDOCS.com/society, and we will see you in the society. Thank you, Dr. Huff, spending this time with us.
Thank you, Dr.
All this knowledge. Woo-hoo. High five to our same name, different pronunciation. Thank you all. And we will see you guys next time. Thanks for checking us out. Bye-bye.